Good afternoon, everyone. Thanks for being here today. Before I get started today, I want to talk a little bit about the special session when COVID liability, just briefly on that. We were disappointed, to say the least. We didn't get the COVID liability done in special session. Frankly, there was some, I had met with senior leadership, or with the Senate leadership and the House leadership, trying to figure out a solution to get this done in a very short time frame of a window of opportunity. We stuck to that plan. Unfortunately, there was some new language that was brought in that was outside the scope of the special session call, so things had to be changed at that point. And again, I want to thank the legislature. I know there was many senators, many people in the House of Representatives was trying to do something for our businesses, our schools, our churches, and our healthcare industry as a whole. So hopefully that'll be a priority come January 1 to move that forward. It's unfortunate we didn't get it done. As you know, yesterday we announced a partnership with healthcare services company Vizient to expand our statewide hospital capacity. 12 hospitals across the state have agreed to participate, including North Kansas City Hospital, St. Luke's Health System, Liberty Hospital, BJC Healthcare, St. Luke's Chesterfield, Northeast Regional Medical Center, Mozak Life Care out of St. Joe, Maryville, and Albany, Hannibal Regional Healthcare System, Mercy, SSM Healthcare, Southeast Health, and Cox Health. Staffing continues to be one of the biggest challenges right now, and we are hopeful that this partnership will provide some much-needed support and relief for our hospitals. In addition to our healthcare system, we also continue to keep a close eye on COVID-19 in our schools. As you may know, DESE and the Department of Health and Senior Services are partnering with Washington University, St. Louis University, and the CDC to better understand the impact of COVID-19 mitigation strategies have on transmission of the virus in our school systems. This weekend, CDC partners will arrive in Springfield and the St. Louis area to begin a review of the public health measures in place among school populations. Schools participating in this pilot project are currently being identified in St. Charles County, St. Louis County, and Greene County. I want to note that the participation is completely voluntary for school districts as well as students, families, faculty, and staff. When a case is identified in a participating school, contact tracing will be performed to identify those close contacts. Close contacts will self-monitor for symptoms and be offered the saliva test developed by Washington University at various times during the quarantine period to help identify potential transmission. From the beginning, we have stressed the importance of keeping our students in school, not only for their education, but also for their safety, health, and well-being. Schools that consistently implement mitigation strategies remain among the safest places for our students, which is why we have continually encouraged schools to put these strategies in place. We know that COVID-19 is not going away soon, so it is important that we continue to evaluate the guidance we're issuing at the state level to ensure our procedures are effective and sustainable. We look forward to working with the local public health agencies, Washington University, St. Louis University, and the CDC on this project and the knowledge that information we will gain. As we continue to fight COVID-19, we're very encouraged by recent vaccine news. On a governor's call Monday, Vice President Pence said that the federal government expects a vaccine to arrive by mid-December. We continue to work with the Department of Health and Senior Services and our partners across the state to prepare for distribution. In October, we submitted our vaccine plan to the CDC. We are proud that our plan was used as a model for other states across the nation and are confident that Missouri is fully prepared to take action as soon as a vaccine arrives. We also recently received a compliment from the White House on our COVID-19 vaccine website, which provides Missourians with vaccine information and updates, including safety, research, and production processes. The website also includes answers to common questions Missourians may have, such as when they will be eligible to receive the vaccine and how well it works. This is a great resource to learn more and stay up to date. Our vaccine developments and I highly encourage everyone to utilize the website as we move forward. We are optimistic that a vaccine will provide much-needed relief from COVID-19, but it will still be some time before a vaccine is widely available to the public. Until that time comes, the best weapon we have against COVID-19 is still prevention. We must continue to be responsible and take precautions to slow the spread, especially over the holiday season. Again, this means social distance, wearing a mask, minimize travel, avoid large gatherings, and limit interactions to 15 minutes. Everyone is affected. Every community is at risk, and we all have a part to play in getting through this. Thank you, and God bless. Also, Dr. Williams is here today. He's got some more encouraging good news on the vaccine front. So, Dr. Williams?
Thank you, Governor. And one word the Governor has emphasized throughout, ever since March 7th and before, was partnership. And so we have two very exciting initiatives right now. One, as he's mentioned, is with our vaccination plan. And as you know, we've reported out that we'll be receiving 51,000 doses. That's for 51,000 people. Understanding the Operation Warp Speed always keeps back an additional 51,000 for the second dose, which for Pfizer's 3 weeks away, and for Moderna's 4 weeks away. So whenever we use numbers, we're talking about patients. You don't have to have those. The numbers we use mean 51,000 patients. The news the Governor, we just learned about 2 hours ago, is that a week after that, we're going to get about another 64,000 doses of the Pfizer vaccine around December 21st. The same day, we're getting 105,000 doses of the Moderna vaccine. That's for 105,000 people again. And so we're incredibly excited about that. Cannot thank enough our partners. The Governor and I were just on a phone call with Senator Blunt and all his support and General Perna's support. We are distributing this. It goes straight to the sites. We've been able to increase the number of sites for that first 51,000 patients to 21, which includes our priority areas of long-term care facility staff and also healthcare workers, especially in our tertiary care hospitals. Was on a good conversation last night with Rich Ludwig at Barnes Jewish. They're going to do 10,000 vaccinations in 10 days. To receive the distribution, you have to assure the CDC that you can vaccinate that amount of people in 10 days. You can't hoard it. You can't ask for 10,000 doses and say we're going to use it over 3 months. You have to use it in 10 days. You can store it for 6 months, but the CDC trying to get it out. And so we're incredibly appreciative to our institutions like Barnes Jewish that are going to administer 10,000 doses in 10 days. Just was on a phone call with Cox, which leads me in Springfield. Robin Trotman, our good friend and colleague there. And shortly thereafter, we'll be using the Moderna, the 105,000 doses of Moderna, to reach out to other hospitals and other communities, Hannibal and others. And we will be vaccinating those people in healthcare. The wonderful news about the extra 60,000 doses of Pfizer we're using is we've entered into an agreement with the CDC and Walgreens and CVS. And so we will immediately, starting on December 21st, work with CVS and Walgreens to vaccinate all our residents and long-term care facility staff. That's a new item. As you may know, on Tuesday, the CDC prioritized long-term care residents. We have 58,000 of those right at this moment in Missouri. So thanks to this new allotment, we will start vaccinating and finish vaccinating, we think, by mid-January, all our long-term care facility and staff, and think we're on track to vaccinate all our 300,000 healthcare workers by the end of January. And again, can't thank enough our partners that are doing that throughout the state, just like we partnered in working, as the governor talked about yesterday, in helping with staff for hospitalizations. I want to transition from there to our partnering with St. Louis University, Washington University, the CDC, our school systems. We have been committed to constantly learning and changing our policy. The governor has always been a passionate advocate for the importance of schools, and not only schools, but the incredible values supported by the American Academy of Pediatrics and increasingly others, Harvard School of Health, Brown School of Public Health, that children attending school is really important. It's important for their overall wellness, and it's also important probably for their safety. We think that to be true. And so we have two strategies here in Missouri. So we invited the CDC in, and they're just simply observing and testing voluntarily, as the governor said, to see in both arms. And the first arm is if you're at school, you're identified as a close contact, but you were wearing a mask, and the student who was infected or teacher was wearing a mask, then you're allowed to continue to go to school because you were wearing a mask, and we'll test you to see what your outcome is. The other arm of the study, and this is being done in the St. Charles, St. Louis, and Springfield area, will go home for now 10 days, and we will test them. And the CDC will be here this weekend. They start on Monday, and we're very excited about that. So again, going back to what I said at the beginning, the governor has emphasized all along that one of our great strengths here in Missouri is our partnering with federal agencies, with academic institutions, with our hospitals, and I think that's borne great fruit. So with that, I'm happy to answer any questions.
Hey, Dr. Williams, can't quite see you.
I'm going to look around the corner here.
I asked you a couple weeks ago about CARES Act funding for local health departments.
Yes.
I was wondering if there are any updates on that now that the Senate has signed off on sending that money to the governor's office.
Yeah, we check those right now. We're kind of in the episodic. I get emails every day, and Alex Tuttle in our office, and I saw a great email from the treasurer, Scott Fitzpatrick, addressing a particular county individually that had a question about that. So we are very receptive as we enter into this last month that at any level that any entity has a question, we're more than welcome to be responsive to that and would encourage them to reach out to us. And again, I want to thank the treasurer for being very robust about that.
I have two. One's a quick one. If I heard you correct in those dose numbers, by mid-January, 220,000 people will have gotten doses. Is that correct?
What I think is going to happen is we have a universe in that first 1A phase, Philip, of about 350,000 people. Now, we realize that not all of those will be vaccinated, but we think between our weekly allotments of both the Pfizer and Moderna vaccine, we will be able to meet that goal of vaccinating all our healthcare providers here in Missouri by the end of January. And that'll be receiving their first dose. Obviously, some will get their first dose January 15th and won't get their second dose 3 weeks later for Pfizer, 4 weeks later for Moderna. But clearly our goal is to have everyone have received at least their initial vaccination by the end of January.
And then my second one, after speaking with our local health department this week, we kind of learned that the state often knows more deaths than a county does in terms of how they're reported. At this point, can you make any generalization about where people should go to get the most accurate data, whether it be on deaths, testing, and cases? Should that be the state's central hub, or should they go to their county for that?
You know, I think, again, it depends on what information you're looking at. When you look at deaths, as you know, we've talked about in the past, there is a big window there. It's how long the doctor takes to sign the death certificate to determine the cause of death. And we also reassign deaths. So, and I think I've given you the example before, you may die at Missouri Hospital in Columbia, but you're actually from Pettis County. And so it will initially get assigned to the county, but several weeks later it'll get reassigned to your county of residence because that's where you lived. You just went to the hospital at the University of Missouri. So I think ultimately, if you're looking at it historically, the best place to look is at state data. And that is data that is required by law for us to give to the federal government. So we tend to be, while we may not be quite as speedy as some would like, we tend to put a lot of premium on being correct.
Hi, Connor Kerrigan with the Missouri Times. What's the timeline for when we can expect the additional hospital staff through the Vizient partnership?
Connor, again, I think that's to be determined. I would really probably refer that to Todd. He's really been instrumental in helping that happen. And I think that they're still working through those details, but I know Todd would be happy to address that with you.
What's the timing for vaccinations for residents and staff at the state's congregate facilities, such as mental health, corrections?
Yeah, those again will be in the essential providers. And so my timeline is that will start in February, about February 1st is when I think that will start.
Hi, Dr. Williams. The CDC just put out some new guidelines about holiday travel, recommending that people get tested 1 to 3 days before their travel and 5 to 7 days after they travel.
Right.
In the state of Missouri, does the state have the capacity to handle that kind of testing, and is it readily available enough for people to get that testing if they choose?
Yeah, we looked at those guidelines, and we're continuing to look at them. I think you have to take those, what the goal of that is. I think what they're trying to do in that, because as you may know, air travel, there have been very few cases associated with air travel in which everybody's wearing masks, a very small number locally. But what I think they're more worried about is where you're traveling to, that, once you get off the plane or the bus or wherever, now you're mixing with a lot of different people. And so while I think those are guidelines, if feasible, I'm not sure that's practical for everybody who's traveling, from Sedalia to Kansas City to do that. So I think those are the kind of guidelines that, and these happen from time to time. If you can do it, that's fine, but I wouldn't think they're prohibitive. If you can't do it, you shouldn't. Thank you, Dr. Williams. Thank you, Kelly.
Governor. Have you had any contact with the president-elect, since the election is over, to talk about COVID or whatever?
I have not.
Are you going to reach out, or are you waiting for them to call you, or how does that work?
Well, normally they'll contact us through an email, or the administration will if they have information to put out to you. Much like the vice president, said he was going to be on a call with governors this week dealing with COVID-19. Regardless what state you was from. So they normally put a bulletin out about that, but I haven't seen anything yet from the administration.
Good afternoon, Governor. I want to follow up on something I've asked you about multiple times, and that's the veterans' homes and the investigation. That report came out yesterday, and I talked to Tim Noonan. There's 2 recommendations I want to get your take on. One notes that veterans are living with roommates. They share toilet facilities, shower facilities. The recommendation is for these veterans to reside in private rooms. And the other one is mentioning that they suggest a protocol to allow a limited number of family members to visit their loved ones, saying that a lot of these veterans haven't had contact for months. What is your take on those 2 recommendations, and do you support those?
Yeah, well, first of all, let me talk about the visitation. That's something we've been very concerned with all the nursing homes across the state, and we have made ways that you can do visitations through that across state. Dr. Williams has worked really hard on that. I've asked him to do that because that has been such an issue with the families. So there has been a portion of that already implemented across the state. I'm a little disappointed that Mr. Newman didn't know that, I guess, if he made that comment. The other thing that I would say about that, You know, there was this report come out, there was an investigation done. I'm a little limited to what I can say because I'm not sure what all the outcome of all this is going to be, so I'll try to be as careful as I can. I will go back to when the numbers started rising. That would become a red flag for us here at the governor's office at the state level, and it's why we had this report done, this investigation done. So I think there's some things in that report that's definitely going to have to be addressed and are going to have to be explained.
Hi, Governor. Only one of the hospital systems that you mentioned earlier might affect our area in terms of getting more staff, but I know there's other options you're looking at, but would you be open to more of these kinds of agreements with other companies or maybe more with Vizient?
Well, I think every day you're trying to see what we have in the toolbox, per se, to fight this virus. And I think that's just one of the things. So if there's something else we feel like we can do, we want to do everything we can to be able to give the resources we need to the hospitals or any healthcare providers. I mean, there's different things people are doing in other states, a little outside the box. Even it has to do with home care services that they're starting to try to look at for people in early stages, possibly, of COVID, how to treat them. So I think there's different options out there every day that we're looking at. But again, I rely on Dr. Williams for his expertise on know what those new things are and what's safe and what we can do. But every day we're looking at a way to fight this virus. All right, thanks everybody for being here today. Thanks.